Good morning, everyone. My name is Fiona Fung. The title of my presentation is integrating the core competencies for public health in Canada into the MPH curriculum. In this presentation, I will talk about the recent updated core competencies, my practicum, and the reflections. Let's get started. The first release of core competencies was developed in 2008, and the most recent one was developed last year in 2025. The core competencies are very important for us because they are the essential knowledge, skills, and attitude necessary for the practice of public health. So people anticipate using these competencies in the following aspects, like to determine what role the public health can play in the broader health system and other community systems. The competencies are also our common language. We use them for advocacy and communication. They can be used for organizational and system level planning to help understand what skills that we need to have within our workforce, how allocate resources appropriately to fulfill those skills. They can be used to guide education in post-secondary institutions and to guide training for public health workforce. The last one is they can be used in human resources such as self-assessment, performance management, recruiting, onboarding, promotion, and etc. So in response to this update, the School of Public Health and Social Policy at UVic reviewed the MPH core courses to support the curriculum renewal. The project aimed to map the extent to which the updated competencies that are currently addressed within course syllabi and content, and to identify and address gaps for improvement. I support this project in alignment with my learning goals in developing three competencies: leadership, public health advocacy, and communication. The project allowed me to integrate the competencies into the MPH curriculum from an MPH student's perspective. During my placement, I measured the course content against the competencies based on my confidence level for applying the competencies in a future career. I finally learned to use the competencies as a guideline while mapping the core competencies into the course content or exercises. So in this practicum, I strengthened my leadership skills in public health practice. And I also developed public health advocacy by identifying actions and strategies to move forward through policy and system change, and improve my communication skills through knowledge mobilization to disseminate research findings and evidence to inform options for policies, programs, services, practice, and actions. So I would like to introduce three useful resources and tools that I found in my practicum. The first one is the competency mapping tool on the National Collaborating Center for Methods and Tools NCCMT website. It was developed to help BC practitioners to find many resources that support the newly updated core competencies. You may find that the tool is useful to plan professional development activities, and maybe you can tailor that for your team leads. The second one is the NCCMT workshop and webinars. They are practice-based learning to support career and workforce development in public health. So you can connect with and learn from your peers from different teams within with a broad range of experience and skills. Webinars are usually free to join. and you can share the learning experience, personalized and at your own pace. When the recording is available on YouTube, you may watch them at any time you want, and you can replay as many times as you want. So the third one is the resource from UVic is the professional advice from PHSP. Our professors have the passion and skills in supporting public health development. So you may consider staying in touch with PHSP to build your own network. Some key takeaways from my reflection: it is important to review and understand the true meanings of all 64 competencies. The mapping tool is very helpful, although it does not provide the resources for every competency. If you want more resources to support your decision, you can go over those resources, and they are very handy. I said that because I experienced that when I look at the competency 1.3. I found, I thought that means the critical thinking and public health knowledge, those kind. In my mind, I thought, a different thing. But when I double check with that, I found, they have lots of the evidence-informed decision-making resources there. They talk about the model, how to process to support public health practice. So as a result, I always have that open while I was trying to map the competencies to our courses. The second one is I would encourage you to explore competencies further because the competencies, they are just the basic things we should know. But in this societal changing world and generation, that is not enough, and things change every single day. The third one I would like to mention is very important. That is the Black community health. It's a new area of focus in the competencies. I mentioned that because our course, the current core courses, we actually do not have that piece, so that is missing. If you work in the public health area, you should notice this is very important because Black communities, they are the new focus and need to receive respect on human rights. We expect to recognize the impacts of the afterlife of slavery and colonization on Black people and Black communities. Since it's not included in our courses, then PHSP may consider including the concept of anti-racism more in the course, and maybe develop another course to cover the program gap. We need to learn how to address racism. My positionality as an MPH student from a minority group, I refuse to accepting racism as a social norm. In our practice, we should support decolonization no matter what position we work on. The fourth one is the use of technology in public health. It brings convenience to our life and the healthcare systems. However, we should be aware of the limitations, like artificial intelligence on public health practice. So if we use it in anti-racism, the bias from the past may lead to bias in the future. So our knowledge and the ability of judgment on public health issues with an equity approach are important. And then the new grouping highlights. So if you found it is challenging to remember the categories in the new release, here are some tips. So in the new release 2.0 on the right-hand side, categories 3 and 4 are originally one, or they are they are in blue. And then category as 5 and 7 have been separated out into their own distinct categories. They are in green on the slide on the right-hand side. For the new category domains, we have 2. They are the last 2 one, category 9 and 10. So other categories that remain the same are in black. Yeah, so hopefully this kind of structures will help you a bit. So how this structural change stand out to you? I see a greater need for public health and a stronger public health workforce. The core competencies framework is fundamental for our practice. I would stay tuned for the next release. Last but not least is the land acknowledgement. I am grateful to speak to you today from the traditional ancestral and unceded territory of the Lukwikan speaking peoples, the Songhees and Esquimalt nations. So I have some references on this slide, and thank you. I would like to express my gratitude to people who support my practicum, including our director, Dr. Catherine Worthington, our professor, Dr. Laura Lee, our instructor, Dr. Mira Debar, and the PHSP office, and as well as all of you being here to listen to my presentation.